Hello, everybody. I will speak today about the role of natural therapies in the prevention and treatment of type 2 diabetes. First of all, some words about the project Pharmaceutical Traditions of Sibiu. In 2016, the Romanian Society for the History of Pharmacy, Section Sibiu, started a very nice, very important collaboration with the Brukenthal National Museum, one of the most important museums of Romania, within a cultural educational project entitled Pharmaceutical Traditions of Sibiu. This project is based on the rich medical and pharmaceutical traditions which exist in this area, in Sibiu area. The first hospital in 1292 and the first documentary certified pharmacy in 1494. From 2016 until today and continue in the future also, scientific events with international participation have been organized to promote the values of various natural therapeutic methods, such as like apitherapy, aromatherapy, balneotherapy, diet therapy, homeopathy, phytotherapy, and so on. Our partner, Brukenthal National Museum, one of the most important museums of Romania, with a very nice museum of history of pharmacy, part of Brukenthal Museum, and with a fantastic collection, the most important collection of homeopathic remedies, more of 4,000 old homeopathic remedies, and with the tradition of Dr. Samuel Hahnemann, who, the founder of homeopathy, who passing through Sibiu for a short period, but for an important period for the development of homeopathy. I invite you with this occasion for an integrative medicine symposium conference, which we will organize in this year in the period 19-20 October, entitled Integrative Medicine Today. An important part of the activity of the project, which I presented before Pharmaceutical Traditions in Sibiu, is health education. For instance, the use of natural therapies in the prevention and treatment of various acute disease like flu, COVID-19, etc., and especially chronic disease such as cardiovascular disease, diabetes, various forms of cancer, obesity, and many other diseases, which are very, very present in Romania and all over the world. The health education information were presented in conferences, webinars, and disseminated through social media and mass media to people interested in living better, longer, and healthy. Today, I will present you a disease which is a very serious health problem in Romania and worldwide. Diabetes. Diabetes, everybody knows, is a disease of nutrition and metabolism, which affects the health of millions of people from different parts of the world. In accord with the International Diabetes Federation, IDF, approximately 500 million adults live with this medical problem, with this disease worldwide. And about 95% of those cases are were type 2 diabetes. The predictions of IDF are very pessimistic for the future. By 2045, the number of adults, after the prediction of IDF, the adults with diabetes is expected to increase to 700 million. And great attention, worldwide, millions of people have pre-diabetes. Type 1 diabetes is an autoimmune disease, and usually this type of diabetes develops in children and young adults. Type 2 diabetes is the most common type of this disease, accounting for about 95% of all diabetes cases. Type 2 diabetes is often linked to age, lifestyle factors such as obesity, poor diet, and lack of exercise. We will discuss all these aspects. And the special form of diabetes, gestational diabetes, is a type that occurs during pregnancy. A normal fasting blood sugar level is between 70 and 99 milligram per deciliter, or 3.9 and 5.5 millimole per liter. What are the factors, the risk factors that lead to type 2 diabetes? Want to say that this disease, type 2 diabetes, is a complex condition which occurs in adults and especially in the elderly, and that develops to a combination of genetic, lifestyle, and environment factors. The role of family history is very important. The role of genetic factors is very important in the development in triggering factor for triggering type 2 diabetes. Exists also strong correlation established between obesity and type 2 diabetes. Being overweight or obese is a significant risk factor for type 2 diabetes. And in Romania, after the last statistical information, health statistical information, about 50% of the population is overweight or obese. In this case, the risk for type 2 diabetes is very, very high. Another risk factor, sedentary lifestyle, is a major factor because physical inactivity is a higher risk factor for this type of diabetes. The role of unhealthy food in triggering is very important. A diet rich in saturated fats and added sugars fast food uh, products. This type can contribute to the development of type 2 diabetes. Yes, sure. We know age is a risk factor for all disease, but the risk of type 2 diabetes increase as we get older, especially after the age of 45, 50, 55 years. Diabetes is a silent disease, but with very serious complications like cardiovascular disease, including coronary artery disease, heart attack, and stroke, neuropathy, nephropathy, retinopathy, which can cause vision loss and even blindness, foot ulcers, infections, etc., etc. A lot of complication, difficult to resolve. We will, in the next minute, we discuss about the natural therapies, about the natural products which may help prevent or manage type 2 diabetes. I started with regular physical activity, which can help improve insulin sensitivity and blood sugar control. Only 20-30 minutes of moderate intensity exercise most days of the week will have a good protective, prophylactic effect. Health diet is very, very important. A healthy diet can help improve blood sugar control or reduce the risk of developing type 2 diabetes. A food rich in fruits, in vegetables, in whole grain, lean protein, and healthy fats will help very much, first of all, in prevention of this disease, and after in the complementary treatment, adjuvant treatment of diabetes, type 2 diabetes. But are a lot of interesting and important medicinal and aromatic plants which can be used in the treatment of diabetes. Some herbal remedies such as cinnamon, blueberry, bitter melon, fenugreek, ginseng, aloe vera, and many other medicinal and aromatic plants improve blood sugar control. Also, some food supplements are important in the adjuvant treatment of diabetes, type 2 diabetes, such as magnesium, chromium, and alpha-lipoic acid may also help improve blood sugar control. Stress management technique, and here I want to mention meditation, yoga, or breathing exercise may help reduce stress level for the patients which suffer of this disease. Medicinal and aromatic plants, we will discuss about medicinal aromatic plants indicated in type 2 in diabetes, in this form of diabetes. First of all, cinnamon, Cinnamomum verum, Cinnamomum ceylonicum. Cinnamomum bark contains compounds, active substances like essential oil, cinnamic acid, coumarins, procyanidins, etc., that may help, they improve insulin sensitivity and lower blood sugar level. Cinnamon, it can be added to foods, yes, and a beverage, and taken in supplement and food supplement form. Another very interesting and important medicinal plant is Gymnema sylvestre, utilized traditionally in Ayurvedic, in Indian traditional medicine, to manage diabetes, which this plant improves blood sugar control by reducing the absorption, an important fact, the absorption of glucose in the intestines. The active substances of this medicinal plant, Gymnema sylvestris, are gymnemic acids, Gymnema saponins, etc. And some words about fenugreek, Trigonella phenum graecum. Fenugreek seeds and leaves contain compounds, active substances, that may help improve insulin sensitivity and lower blood sugar levels. It's possible to consume fenugreek as a supplement, spice, added to foods. The active substances in diabetes from fenugreek are trigonelline, which is an alkaloid found in fenugreek with anti-diabetic effects by improving glucose metabolism and increasing insulin sensitivity. Another interesting active substance of fenugreek is 4-hydroxyisoleucine, which is an amino acid derivative and which is unique to fenugreek, which has insulinotropic effects, meaning it stimulates the release of insulin from pancreatic beta cells. It also helps improve glucose uptake and utilization in peripheral tissues. Fenugreek seeds are rich in galactomannan, a type of soluble fiber, which helps slow down the absorption of carbohydrates in the intestine. Aloe vera gel improve blood sugar control and reduce insulin resistance. Active substances which are useful in diabetes, polysaccharides, acemanan, glycosides like aloin, flavonoids, etc. Ginger, another very important spice utilized very much in different gastronomies, but also a medicinal and aromatic plant. Ginger contains compounds like gingerols, ginger diols, zingerone, etc., that improve insulin sensitivity and lower blood sugar levels. Turmeric, curcuma longa, contains curcumin, the major isolated polyphenol, which has been shown to improve insulin sensitivity and lower blood sugar levels. We know that turmeric can be added to foods. It's an excellent spice, or taken in food supplement form. Some words about an important medicinal plant, Momordica carrantia, which is very much utilized in our day in adjuvant treatment of diabetes. Momortica carrantia is known as bitter melon or bitter gourd. It's a plant commonly used in traditional medicine for the management of diabetes. Active substances, active compounds of Momortica carrantia are carantine, vicin, and polypeptide P, which have been shown to have have a hypoglycemic effect. Some studies, or a lot of studies, about Momortica carrantia utilization in diabetes. Studies have shown that Momortica carrantia may have potential benefits in the management of diabetes. For instance, a meta-analysis of randomized controlled trials found that Momortica carrantia improved fasting blood glucose levels in people with type 2 diabetes. Another study found that this medicinal plant significantly reduced glycosylated hemoglobin levels, a measure of long-term blood glucose control. And now some words about blueberry, which is a plant, very important plant of our country, wild flora. Blueberries are a type of fruits that is low in calories and high in active substances like antioxidants, fiber, different vitamins, especially vitamin C and K. Blueberries are also known to have anti-inflammatory properties, which may be beneficial in the management of diabetes, which is a chronic inflammation condition. Blueberries may reduce insulin resistance, may help regulate blood sugar levels by improving insulin sensitivity and reducing insulin resistance. Blueberries reduce the fruits, which I discuss now about the fruits, reduce the risk characteristic specific of the patient with diabetes too, the risk by improving cardiovascular health. People with diabetes are at a higher risk of developing cardiovascular disease, and blueberries may reduce significant this risk by improving cardiovascular health. A study published in the American Journal of Clinical Nutrition found that consuming blueberries daily for 8 weeks improved endothelial function, a key factor in maintaining healthy blood vessels. Blueberries fruits protect cognitive function. Diabetes has been linked to an increased link of cognitive decline and dementia. Blueberries may help protect cognitive function by reducing oxidative stress and inflammation in the brain. Myrtilene, one of the most important active substances of the fruits and also of the leaves of this important medicinal plant. Several studies have been investigated the potential anti-diabetic potential of myrtilene, which improve insulin signaling and glucose uptake in cells. Myrtilene has also been shown to have antioxidant and very good anti-inflammatory properties, which may contribute to its anti-diabetic effects by reducing oxidative stress and inflammation, which are associated with the development of type 2 diabetes. The researchers also found that blueberry leaves had higher levels of total flavonoids than the fruits, suggesting that they may be a valuable source of flavonoids uh, for human consumption. And tribute to Professor, Dr. Pharmacist Sibiu, who died in February this year. In numerous books and articles, Dr. Ovidiu Bojor, member of the Romanian Academy of Medical Sciences, mentioned the importance of myrtillin, which he called symbolic vegetable insulin, in the phytotherapeutic treatment of diabetes. Some words about bee products which are utilized in diabetes. It's possible to utilize honey, but in small quantities. Honey is the best natural sweetener. It has a lower glycemic index than refined sugar, and may have some benefits for people with diabetes. Antioxidant, anti-inflammatory properties specific for honey, but in small quantities. Possible to utilize, but in small quantities. Bee pollen is indicate for the persons we suffer of this form of diabetes. Bee pollen is a rich source of vitamins, of minerals, and antioxidants, which a lot of studies suggest that bee pollen may help reduce blood sugar levels and improve insulin sensitivity. The most important natural product is propolis. It's very clear for me and probably for the most part of the participants of this important congress organized by the Romanian Society for Apitherapy, Phytotherapy, and Aromatherapy. Due to some active substances like flavonoids, glycine, tactocrizine, quercetin, etc., phenolic acids, caffeic acid, phenethylester, etc., which improve blood sugar control and reduce inflammation. Royal jelly, the food of kings, contain proteins, peptides, flavonoids, adenosine, vitamins, minerals, etc., essential amino acids with benefits, important benefits for people with diabetes due to the immunostimulant, antioxidant, anti-inflammatory, revitalizing effect. Another soft therapy, Gemmotherapy, is utilized in diabetes. Gemmotherapy, as a branch of biotherapy, is a treatment method whose specific feature is the use of extracts from fresh embryonic plant tissue, meristematic tissue, like buds, young branches, barks, shoots, seeds, roots, seedlings, etc. Gemmotherapy, which today is used worldwide in different countries, was developed in France, the work of the Belgian doctor Paul Henry. And in our country, in Romania, exist two important companies which produce good quality Gemmotherapy, Hofigal in Bucharest and plant extract in Cluj-Napoca. Some Gemmotherapy which are useful in adjuvant treatment of diabetes. The Gemmotherapy prepared from fig tree buds has a hypoglycemic effect and help lower blood sugar levels. Black currant buds obtained from the plant, very important medicinal plant Ribes nigrum. The Gemmotherapy prepared from black currant bud has a regulatory effect on blood sugar levels and improve insulin sensitivity. They also have anti-inflammatory and antioxidant properties, which are very important for a patient with diabetes. The Gemmotherapy obtained from birch bud has a diuretic effect, which help reduce fluid retention and improve kidney function, regulate blood sugar levels, and reduce the risk of developing complication. I mentioned only some complementary and alternative therapies which are utilized in the prophylaxis, in prevention, and adjuvant treatment of diabetes, type 2 diabetes. But a lot of other complementary natural therapies, soft therapies, may be used in prevention and treatment of diabetes. For instance, acupuncture, aromatherapy, Ayurveda, balneotherapy, manual therapies, TCM, because we know acupuncture is a part only of TCM. TCM is more complex. The other soft therapies are useful in the management of the patients who suffer of this chronic disease. And finally, some conclusions. The various natural therapies can be associated with the allopathic treatment of type 2 diabetes, and thanks to synergies of potency, can significantly contribute to improving the health and quality of life, very important, of patients who suffer from this chronic disease, widely spread all over the world. Thank you for your kind attention. And a gentle reminder, invitation for an online conference, with important international participation, Integrative Medicine Today, 19-20 October. Thank you for your attention.